following is the most appropriate initial treatment? Box Metro, Ceph, track, so no antibiotics. Okay, 29-year-old female presents to the clinic, 3-day history of dysuria, increased frequency, urgency, complaints suprapubic, and she has a fever. Recurrent UTIs the past year, no discharge, vitals normal, lower abdomen, tender lower abdomen, no CVA tenderness. Okay. Urinalysis shows numerous white blood cells, red blood cells, positive nitrites, which of the following is most appropriate. So I think it's some kind of ascending infection that's probably affecting the bladder, some kind of cystitis. And so to treat cystitis or some kind of infection, I know E. coli is like the most common. So definitely you got to give antibiotics. And I don't think it's Metro because Metro is more STD. Let's see, what would you want to give? I don't think. Anyway, this comes down to kind of rote memorization of what you use to treat. I'm just gonna say ampicillin. So let me give some. I don't know. It's probably a Cipro. Yeah.
Yeah,
Cipro.
Cipro is going to be good here, right?
It's probably,
Ciprofloxacin.
probably a broad spectrum, right, or something.
Yeah, I mean, if you're talking about IV, right? Penicillin, beta inhibitor, more severe infections such as intra-abdominal infections or complicated UTIs. So when you're talking about UTIs, you're talking about like simple versus complex,
Yeah.
right? Complex meaning I just make it real simple, right? Obviously, you're an OB, so you probably even know even more about UTIs than I do. But the way I remember it is, complicated UTIs is just like you're really, really sick. Maybe you're septic, right? Maybe you haven't responded to the first line treatment, right? Those are considered more complicated. You get what I'm saying? So anytime you're thinking about IV, you're thinking about this has to be administered in a kind of a hospital setting, right? You get an injection, right? So I always think injected antibiotics or IV antibiotics is going to be harder core, right? Like you can't just giving you an example, right? You can't just show up somewhere and get IV antibiotics, right? Usually it's a hospital setting. So I think about this patient right here, right? And you're looking, younger female, 3 days history of kind of pain with peeing, increased urgency, increased amount of frequency. She has a little bit of white blood cell count elevation, and positive nitrites means mainly E. coli, right? And a little bit of suprapubic pain. So this is a classic UTI, right? So in my mind, right, if it's simple, then some kind of oral antibiotic should be enough. Obviously, if they say, oh, she failed oral antibiotics and it's been going on for more than a week and now she's really, really sick, then I start thinking, oh, you probably have to start thinking about some IV antibiotic options.
Okay.